New research suggests that using a heel lift provides the fastest and most effective pain relief for Achilles tendonitis. Clinical trials suggest that they can even outperform the gold standard treatment of eccentric exercises. But not all heel lifts are created equal, and some might actually make things worse. Hey everyone, Dr. Jeff Peng here. As a sports medicine doctor, I've helped countless patients with Achilles tendonitis get back on their feet, and one of my top recommendations is using a heel lift. In this video, I'll break down why heel lifts are so effective, what to look out for when buying one, and how to use them properly to accelerate your recovery. So the science behind heel lifts is pretty simple. Heel lifts slightly change the angle of your foot, which reduces pressure on that super tender spot where the Achilles tendon meets the heel bone. And just offloading the Achilles tendon by a little bit will provide immediate and lasting pain relief for your ankle. Researchers from this study gave people a 20mm or about a 3/4 inch heel lift to wear. The participants noted immediate improvement in pain during walking after inserting the heel lift into their shoes. They were then asked to wear the heel lift for 2 weeks straight, and the results were rather striking. The research subjects had significant improvements in pain, as well as how they walked. They had faster walking speeds, longer strikes, and better ankle flexibility. These are all markers for improved function in the Achilles tendon. But now the big question is, how do these heel lifts compare to eccentric exercises, which is the gold standard for Achilles tendon issues? That's where this second study comes in. It was a randomized controlled trial comparing heel lifts to eccentric exercises for mid-portion Achilles tendinopathy. This is where the problem is in the middle of the Achilles tendon rather than down by the heel. The results showed that the heel lifts didn't just hold their own, they outperformed eccentric exercises in both pain relief and function. Eccentric exercises have always been touted as the solution. They can be painful to do, and in my experience, most people aren't thrilled about sticking to a demanding rehab routine, especially after a long, hard day at work. Heel lifts, on the other hand, just pop them in your shoes and go about your day. The researchers even looked at patient satisfaction, and guess what? People loved the heel lifts. They were effective, easy to use, and well liked, and that's the trifecta right there. Now, there are some caveats to these studies. They had a small sample size and focused on short-term effects, so we can't say for sure how heel lifts hold up in the long run. Still, the results are promising. And this is arguably the lowest barrier treatment. Just pop them in your shoes and then you don't have to think about it anymore. Okay, so if you're thinking about trying a heel lift to help with Achilles tendinopathy, here's how to pick the right one. First, thickness really does matter. The first study used a 2 cm or about 3/4 inch heel lift, whereas the second study used a lift that was 1.2 cm or just under half an inch. I've included a link to a sample product in the video descriptions that you can check out. The beauty of this is that it is adjustable, so you can start with a lower lift around half an inch and increase the thickness if you need it. The next thing is that the material and firmness also matter. You want to look for a firm lift that won't squish under your body weight. Gel and foam lifts can be comfortable at first, but they need to be sturdy enough to maintain that elevation. And don't forget about sizing and adjustability. Most heel lifts should fit snugly in your shoe, and they come in small, medium, or large sizes. My current treatment approach to Achilles tendon problems is to first purchase a heel lift. This is a simple and cheap option and provides immediate pain relief. If you're still having pain, try buying Voltaren gel. This is a topical anti-inflammatory and pain medication that is also cheap and can be fairly effective. Think of it like topical Advil. It can be just as effective without dealing with the side effects of taking pills. The last thing to do is to then work on the Achilles tendon exercise program. The most effective treatment plans take a multimodal approach. So while heel lifts can provide immediate pain relief and functional improvement, we also want to help that tendon heal. The next video will show you the best exercises to help treat Achilles tendonitis pain. Use these interventions and you'll be back to physical activity in no time.